Hi everyone, my name is Meredith Hansen and I'm an occupational therapy doctoral student at Cleveland State University. Although there is a growing number of neonatal therapists and increased recognition of the value in their scope of practice in treating preterm and medically complex infants, there remains a current lack of research, clarity, consistency of practice, and exploration of patterns of the role and implementation of neonatal therapists within the NICU. More specifically, there remains a need to define and measure the impact of an embedded neonatal therapy team within the NICU. My capstone project focused on measuring the impact of an embedded neonatal therapy team in the Level 4 NICU at University Hospital's Rainbow Babies and Children's located in Cleveland, Ohio. The focus of my capstone included program development and evaluation, in-depth clinical practice, and research skills through data collection. The aim of my capstone is to highlight the value of an embedded neonatal therapy team, increase awareness and understanding of the skilled role of the neonatal therapist, and recognize the overall impact of the embedded neonatal therapy team in further enhancing neuroprotective developmental care of premature and medically complex infants. My capstone experience consisted of recognizing current themes of neonatal therapy practice, exploring the role of the neonatal therapist in providing care to preterm infants born less than 32 weeks gestational age through chart auditing, and gaining valuable nursing perspective through a neonatal nursing survey. In comparing the traditional rehab model to the embedded neonatal therapy team, in the prior rehab model, services were consult required, whereas with the embedded team, every patient receives an automatic order upon admission. With the prior rehab model, the neonatal therapists were present on-site 5 days a week compared to the now 6 to 7 days a week with at least one weekend day. In the prior rehab model, there was no evening availability, whereas with the embedded team, there is now evening availability every Thursday. The biggest comparison and impact that I measured during my capstone comes from the data I collected exploring the role of the neonatal therapist in treating patients less than 32 weeks GA. In the prior rehab model, the neonatal therapists were providing care to less than 5% of the caseload born less than 32 weeks GA. Since the implementation of the embedded team, the neonatal therapists are now providing care to 42% of the caseload born less than 32 weeks GA. This is a significant impact. The embedded team functions within a zone system. This includes 6 certified neonatal therapists at its core, made up of OTs and PTs that provide services to both the NICU and step-down units. These are broken into 4 sides, Side 1 and 2 which cover NICU, and Side A, B, and Side BC which cover the step-down unit. Every month the neonatal therapists rotate which side they cover. This allows for the embedded team to follow patients from admission through discharge, have a more consistent presence with families, and provide more in-the-moment support for nursing staff. During my capstone experience, I identified and explored 3 common themes of practice which included patient care, administration, and nursing relation. From these 3 common themes of practice, I identified sub-themes, which include role identity, advocacy, and parent engagement, which align with patient care, procedural, physical presence, and team dynamics, which align with administration, and collaborative patient care, teamwork, and role identity, which align with nursing relation. In measuring the impact of the embedded neonatal therapist in treating patients born less than 32 weeks GA, I conducted a chart audit from February to March 2025. The number of patients on the caseload born less than 32 weeks GA totaled 54. Of those 54 patients, 23 had received an eval before reaching 32 weeks PMA, which is equivalent to 42% of the caseload. Once again, this data I collected highlights the impact of the embedded team in comparison to the prior rehab model, demonstrating a significant increase in providing care to patients born less than 32 weeks GA. 28 and 40 weeks GA is a critical timing in which the newborn undergoes a rapid brain growth spurt and myelination begins. To provide a greater perspective in the role of the neonatal therapist in providing care to patients born less than 32 weeks GA, the 23 patients from the chart audit that received an initial evaluation before reaching 32 weeks PMA received neuroprotection, 2-person care, positioning support, and nurturing touch. For the neonatal nursing survey, I gathered nursing perspective in regard to how neonatal therapy services are currently being utilized, has a positive change in developmental care practices occurred since implementation of the embedded team, where do nurses feel they need continued support from the neonatal therapist, and overall, what do the nurses feel the biggest impact has been since the implementation of the embedded team? In total, I received 65 responses. Lastly, in completing my capstone experience, I presented my findings to UH stakeholders, proving the impact and value of the embedded team, highlighting key opportunities for continued support of nursing staff, offered new perspective in understanding the scope of neonatal therapy practices, and overall showcased benefits to patients, families, nurses, staff, and the institution. Overall, my capstone experience resulted in an increased knowledge and awareness of the role of the neonatal therapist, a greater recognition in the positive changes of developmental care practices following the implementation of an embedded neonatal therapy team in comparison to the prior traditional rehab model, an increased recognition in the overall impact of the embedded neonatal therapy team in further enhancing neuroprotective developmental care of premature and medically complex infants. By advocating for and highlighting the value of the neonatal therapist's role and scope of practice through the implementation of an embedded neonatal therapy team, we can continue to close the gaps in current literature, accomplishing the need for further research and clarity in the exploration of patterns of the role and implementation of neonatal therapists within the NICU.